Hello, I'm Terry Morgan with the Virginia Board for People with Disabilities, and I'm here today to talk to you about Medicaid. We're hearing a lot of concerns from family members, people with disabilities, um, provider organizations, people who are a part of the workforce in Medicaid about concerns uh, that cuts at the federal level could have on their daily life. And it's a real concern. It's a real jarring time. And we want to try to equip you with some information to share your story, the importance that Medicaid has in your life, and um, how your voice matters and can make an impact. The Virginia Board is fortunate to be a part of a larger network. We serve as Virginia's Developmental Disabilities Council, and there are 56 DD councils, one in every state and U.S. territory. And all DD councils are really concerned about cuts to Medicaid and are hearing from people in their states. And people across the country are talking with their representatives in Congress to try to educate them about what Medicaid means to them. And we want to provide you with some information and some tools that can help you do that because it's so important. There's a lot of confusion about Medicaid, and you are the educator of lawmakers, and they need to hear from you. You are the experts, and you are the perfect people to educate lawmakers on what Medicaid means to you. A lot of representatives get confused about Medicaid, Medicare, the Affordable Care Act. They do not know that the DD waivers and the CCC Plus waiver are an alternative to living in an institution and make it possible for people with disabilities to live in the community and stay out of costly facilities. So it's important that you share that message and how you use Medicaid and concerns about the cuts. Calls to Congress are making a difference. We're hearing this from national advocates, and some legislators are beginning to understand the impact cuts to Medicaid will have on people with disabilities and people in their districts. Many disability constituents are connecting with lawmakers. They're learning what members of Congress think about Medicaid during their conversations. And some members of Congress believe things about Medicaid that are not true or do not reflect how Medicaid works in real life for real people. I'm going to talk through some of the things that constituents are hearing from Medicaid about lawmakers to help you prepare for your own conversations and to help you have responses to address some of the information that's not completely accurate, and how you can educate lawmakers. So we hear a lot, in particular lately, about fraud, waste, and abuse in Medicaid, and that cutting Medicaid will stop Medicaid fraud. And concerns about fraud, waste, and abuse are being discussed, and lawmakers are talking about it. And when you hear something from a legislator, it's important for you to talk about what you experience and what you know. It's important for you to share about your use of Medicaid services, that you don't commit fraud and neither do any of the people you know, and that cutting the program doesn't get rid of fraud. Audits are really the tools that do that. And fraud, waste, and abuse can be a cover. Nobody wants fraud, waste, and abuse, but it can be a cover for broader cuts. And it's important to, talk about your experience. You don't need to research fraud, waste, and abuse. You need to talk about your experience and how you use Medicaid, and it doesn't involve fraud, waste, and abuse. Lawmakers are also saying that, your loved one won't be harmed. We're just rooting out fraud and abuse. And while it may be reassuring for someone to say that you won't be affected, the scale of cuts being proposed would impact long-term services and supports. Lawmakers cannot guarantee that big cuts will not impact you and your services, and it's important for them to hear that message. We're also hearing lawmakers say that, people like you are not the target. These cuts won't apply to people with disabilities. And this is, just something that they cannot guarantee. The largest population of people in Medicaid are kids and pregnant moms. there's a lower population of people with disabilities. However, people with disabilities make up about 2/3 of Medicaid spending. And you may not be the target, but the reality is that people who use Medicaid the most are highly likely to be impacted. And it's important that this be shared, that there cannot be guarantees. And, they may be looking for fraud, waste, and abuse and targeting other populations, but it is going to impact people with disabilities. And again, you may hear lawmakers say that when you're talking about Medicaid, that they're referencing Medicare or the Affordable Care Act. There's a lot of Medicaid is a really complicated program, as you know, and Medicare and Medicaid can often be confused. And there are people with disabilities on all three of these programs, but the programs are very different. And it's important to educate lawmakers about what Medicaid does for you. Medicare doesn't pay for long-term services and supports, and making sure that you have discussions about the right program when you're talking with your representatives is important to help educate them and understanding the difference between Medicaid and Medicare and how Medicaid supports long-term services and supports that you use to keep you in the home, in your community. Medicaid serves a number of people, but people with disabilities could be the largest group impacted by cuts. We're hearing that some lawmakers will tell their constituent that their positions on Medicaid are on their website. Sometimes when people call the office, they make the person who calls to do the research on the lawmaker's position versus stating the position. And it's important that you ask, really clear and specific questions about the position of your lawmakers. Oftentimes, the website may have something related to the Affordable Care Act, but nothing on Medicaid. And there may be positions that don't speak to Medicaid at all. So, it's helpful to go to the website ahead of time and see what's actually on their website. And if they do have any positions on Medicaid, and ensure that you can specifically ask them, that you want to hear their position on Medicaid cuts and not let them kind of sidetrack you or sideline you, telling you to go back to their website to get their positions. And lawmakers are going to try to reassure their constituents that they don't think that the cuts will happen, as a way to have you not pay close attention. The only way the cuts won't happen is if constituents talk to their representatives. It's easy for lawmakers who aren't personally impacted by Medicaid cuts to say that we're not targeting you, we're not planning on cutting your benefits, but they don't fully understand the impact. And it's your story and it's your voice that's going to educate them in understanding the impact of Medicaid cuts. And to ask lawmakers why they think these cuts won't happen. Ask questions, if you get a statement like this, these cuts won't happen. Why are they saying that? What's making them believe that these cuts won't happen? And some lawmakers are saying we don't intend to hurt people with IDD. And perhaps that statement is true, but given the highest cost population that uses Medicaid the most, it's highly unlikely that people with disabilities won't be impacted. That these cuts will impact people with disabilities, those who use services the most for the longest period of time, and they need to understand this. So it's important to set that correct when you do speak with your lawmaker. Some constituents are hearing lawmakers say that we'll put protections in place so that people with IDD are not impacted, that they don't want to hurt this population. But putting protections in place or exemptions are a really difficult thing to do. Certain things states have to pay for, like institutional care, are a requirement in Medicaid. That means that cuts will result in states having to pay a lot more money or change what they're doing to match what is currently being done. So in other words, um, states are going to have to make decisions about the Medicaid services that are provided that are not required, that are not called what's entitlement services. And states can do one of three things when this happens. They can cut who's covered by Medicaid. They can cut what the services that are provided, or they can change how providers are paid. But there's not a lot of other options for states when there are drastic cuts to their Medicaid program. And this goes along with we will exempt people with IDD, kind of different versions of the previous statement that cuts won't apply to people with IDD. But creating exemptions is difficult and will likely not cover everyone. People will be left behind and will be harmed. So there will be people that think they are exempt or should be exempt who are not exempt. It's going to create more confusion. It's going to be administratively challenging to manage specific populations of people who are exempt. And it's just not the right approach. And, Medicaid needs to be protected. And the people who use Medicaid need to be protected from harmful cuts. Some lawmakers are saying it will be up to states to decide whether they cut Medicaid. And this is a true statement. States will need to decide how to fill the budget hole created by Medicaid cuts. So if there's a huge cut in Medicaid at the federal level, it's going to be up to states to decide how they make up for that cut. If they're going to put more state dollars into funding Medicaid. And again, basically, there are three options for states. They make cuts in who is covered. They cut what services are provided. And home and community-based services are optional services. Or they change how much they pay providers. So the options for states are limited. Lawmakers are saying we aren't cutting Medicaid services. This is what constituents are hearing. And this is a true statement. The federal government is not cutting specific Medicaid services. They're telling states how to decide what to cut. So they're looking at cuts to the federal budget for Medicaid services, and each state is going to have to make decisions on what to cut in that specific state. Some lawmakers are saying these cuts won't occur right away. Oftentimes, when there's a change in public policy or funding, there may be a date when the changes take effect. So it might not occur within the first month, 6 months, or even year, but the scale of the cuts doesn't mean that the cuts won't have a big impact on people who rely on the services. And we need to ensure that Medicaid is protected, that people who use services are able to get what they need. And if a legislator says that these cuts won't occur right away, that doesn't mean the impact won't be just as big and that Medicaid needs to be protected now. Some lawmakers are saying there isn't a bill, so I don't know what will be in it. We need to know what it says first. And this is really kind of, to divert away from your question. It's true that a bill hasn't been publicly released. However, there is enough information out there to understand what the ideas are that are being considered. A lot of ideas are not new ideas, such as Medicaid block grants and per capita cuts. There's enough information to be concerned and question lawmakers on their position. These proposed cuts have come up in the past, but they're coming to the forefront with such rigor now that there is a lot of concern, and lawmakers should be able to speak to those concerns and about what's being proposed and has been proposed in the past. So some advocacy tips for you when you speak with your lawmakers is to be assertive. Correct lawmakers when they say things that are incorrect or do not match your Medicaid experience. Again, your Medicaid experience is important, and it's important for you to convey that and to correct information that isn't accurate or isn't a part of your experience. Challenge lawmakers' assumptions about who is in Medicaid and how Medicaid money is used. And it's also important to listen. What you hear from your lawmaker may change, but what you hear is important for the broader advocacy community in understanding the messages and the information that lawmakers need to hear, so they can be fully informed about the impact of Medicaid in their communities and on their constituents. Focus on how Medicaid cuts impact you, your family, the local workforce, your community. Lawmakers may change messages to constituents, but that is not the same as changing how they might vote on Medicaid cuts. So being able to ask direct questions, being assertive, but polite, and asking for their position on Medicaid cuts. So some action steps that you can take. It's important that if you haven't been engaging with your federal lawmakers, that you do engage, that you use your voice, that they know about you and how Medicaid impacts you. And if you have been engaging, that's great. You need to keep engaging. Lawmakers need to understand Medicaid, what Medicaid means to constituents, and how lives will change if Medicaid is cut. So you have 5 elected officials who represent you. 2 U.S. senators, 1 U.S. congressional representative, 1 Virginia state senator, and 1 Virginia state delegate. It's important that you learn how to connect with your representatives, that you call them, that you email them. You can program their numbers and emails into your phone and stay in contact on a regular basis. You can email or leave a message anytime. It's okay to contact them whenever you can, even at night. It's easy to talk yourself out of making a connection or making a call. It's difficult to put yourself out there, make yourself vulnerable, share your story. But you can do this, and your voice does matter. Your experience matters, and we really encourage you to get in touch with your representatives at the federal and state level, and plan on checking in and following up frequently. The more that they hear from people, the more they understand how concerned people are, the more they know how this is going to impact their state and their community. That's what can change the tide for potential Medicaid cuts. So I encourage you to let us know what you hear from your legislators, so that we can continue to help with messaging and with sharing information. So in Virginia, there's 2 U.S. senators, Senator Tim Kaine and Senator Mark Warner. Their phone numbers are included on the slide, so you can call them, and you could also look at their websites and see what their statements say about Medicaid. These 2 senators serve everyone in Virginia, so they are your senators, and you should be contacting them. You also have 1 representative, 1 congressional representative. There are 11 congresspeople, women congressmen in the state of Virginia. So it's important for you to find out who your congressional representative is. There's a website where you can look up your representative, www.house.gov. You can Google it and you can find who your state congressperson is. Again, there are 11. And the map here shows you the different districts, the different congressional districts, to find, your address, determines who your state representative is in Congress. So there are 11 Congress members, 1 for each of the 11 districts. Their phone numbers are listed here. You can look them up on the website, so that you can communicate with them directly, schedule meetings, share your story. When you go to their website, most of your representatives have newsletters, have social media accounts. They have constituent newsletters. So, sign up for their newsletters. Put in your email address. They'll send you their newsletters that will keep you up to date on any in-district town halls or events the members will be holding. It will include information on their policy positions so you can stay up to date what their position is regarding Medicaid, or if they're not saying anything about Medicaid at all. That's information, for you, for when you do speak with them, to say that you can't find anything about their positions regarding Medicaid cuts. They may send you polls and ask for feedback. It gives you another opportunity to share your position and what's important to you. You can also follow your representatives on their social media accounts. It's important to know what they're up to, where they're at, what they're talking about, and for you to engage with comments about your experience in Medicaid. And you can you can communicate with them over their social media accounts and ask them questions about potential Medicaid cuts or other issues that are concerning you right now, and you would like to know their position. Most representatives have a Washington, D.C. and in-district offices, and those two offices have kind of a different role. So the DC office often has a health or Medicaid policy staff who's in the office, who's their expert on the topic. They follow federal bills and advise members on Medicaid changes. This policy person, their job is to listen to people's opinions on healthcare bills, advise the member on health policy positions, and it's often the DC office that develops messages and responses to constituents. Their in-district office is also really important, an important contact. Their role is constituent services, and you are a constituent. They track and report to the DC office about what they hear from constituents. They hold in-district meetings with constituents, and they know when their member will be in district and when they are holding listening sessions or will be at events. So both offices are important to connect and engage. And you'll get different information and have a different conversation, say with the policy person, the health policy person at the DC office, or their constituent services staff at their in-district office. So connecting with both is a great tool. So what are disability constituents asking for when they call? When they call the DC office asking for their lead health or Medicaid policy person, you want to know who that person is. You want their contact information. You have every right to ask for this information and to be able to communicate with their health or Medicaid policy person. Request that specific person because you want to email them, you want to send them a Medicaid story, you want more information about their position on Medicaid. You can request a phone call or a Zoom meeting to discuss Medicaid cut concerns. You can request an in-district meeting. Often, when legislators are in their district, they will hold, constituent meetings or office hours, and you want to be a part of that discussion. And you can request follow-up with lawmaker on their positions on Medicaid cuts, that you want to continue this conversation, you want to stay engaged, and you want them to let you know if their positions change. If the office doesn't want to give you the name of their health policy staff or contact information, ask again. You want a relationship with the person who is talking to the member about Medicaid. So, ask again for their name and contact information. Work email addresses, and employee names and public offices that serve constituents can be shared. So they should be able to share the work email address and the name of the person. Communication is a part of their work. You are their constituent and they should be communicating with you. If policy staff is not available, leaving a message and following up with an email with what you said on the phone is important. So if you can't get somebody on the phone, leave a message. Follow up with an email saying that you left a message and what you shared in that message and that you'd like to schedule a meeting. Ask for the health policy staff every time you call because this is important to you, and you know that this person is the one who's advising your representative on health policy matters. Now, if you want to request a meeting, here's a brief script, something that you can use. So as an example, hello, my name is Jenny Jones, and I live in Chesterfield, Virginia. I'm calling because I'm a member, because I use Medicaid waiver services, which is a Medicaid program. I'm very concerned about proposed cuts to Medicaid. I know Congressman X has a local office, so I'd like to schedule a meeting with the health policy staffer to talk through my concerns. So this is just an example of what you can say when you call to request a meeting. You can meet one-on-one or as a part of a group. If you know other people in your area who have the same concerns that you have, and you want to have a group of you go and talk with a legislator, that's perfectly fine. Sometimes that can have a big impact. Just some tips on if you do meet as a part of a group, it's helpful to practice what you want to say before the meeting. If you're part of a group of local disability constituents attending a meeting, and planning before the meeting is a good idea. You need to make sure that you are each making different points, that you're not repeating each other's points, maybe telling part of your story to tell a bigger message. And again, preparation for that is important. If you'd like some help with that, you can contact myself or Jen Krajewski, and we'd be happy to have a conversation with you and help with some of that planning. When you get a meeting, what you want to talk about, your personal story about how Medicaid matters to you and your family is important. Those personal stories are often what makes the difference. They're real, they're powerful, they're impactful. So sharing your story. Other people who rely on Medicaid and would be impacted on Medicaid cuts, talk about the broader community and how Medicaid cuts can have an impact. It's also, good to talk about the number of people who help you who are paid by Medicaid. Jobs, there will be real impacts to the job, to the workforce, to providers if Medicaid is cut and people's services are cut. So there's, real potential for workforce issues and for the income Medicaid brings in that pays people who then put that money back into the economy. And professionals that you work with that show many different people would be impacted by Medicaid. Now, some things you can ask in meetings. You can just ask people very directly, ask your legislators, their policy staff, to commit to not voting for Medicaid cuts. You can ask them to conduct an in-district Medicaid forum because there are lots of people in their districts who will be impacted, and a Medicaid forum is a way to communicate about their positions and to hear directly from people. You can ask the member what they are doing to talk publicly about Medicaid cuts. Some policymakers may want to really keep this under the radar and not talk about it publicly because they know it's unpopular. So they need to be asked directly what their position is and asked to talk about their position publicly, and that you want to share their position publicly. You may have a legislator who's is committed to no Medicaid cuts, and they share that very clearly, and ask them if they're able to convince other members of Virginia delegation not to support Medicaid cuts, and what you might be able to do to convince other members not to support Medicaid cuts. We've talked a little bit about in-district town halls. If you do go to an in-district town hall and you're encouraged to do so. Be prepared to share your story in 3 minutes, quick. If you go by yourself, again, have that 3-minute story. If you go as a group, prepare so you are hitting different points, sharing different experiences, and different reasons why Medicaid is important. Make sure you all talk ahead of time if you're going with a group, and again, prepare, show how many impacts there would be if Medicaid is cut, and be sure to have an ask. Can you commit to preventing Medicaid cuts? It's important to ask that question, because asking that question is going to make your representatives think, before they answer and after they answer. We have some Medicaid resources that you can use with lawmakers, and we're going to be posting more resources on our website. There's a Virginia Medicaid at a Glance two-pager that provides an overview of Medicaid in Virginia. There's also some great Medicaid data and Medicaid facts, a Medicaid fact sheet from the Kaiser Health. We encourage you to use that information to help make your case, to use it as a handout, and we're in the process of developing some additional resources that may be helpful to you. So action step 2, many people and workers will be impacted by Medicaid cuts. We've talked about this a little bit, that Medicaid is important to the people who receive those services, to the families who receive those services, but there's also a much broader group of people who will be impacted by Medicaid cuts. So people with disabilities can ask your case manager, your service providers, personal care agencies, therapists, and others who provide services to you, are they aware of potential Medicaid cuts? Have they called lawmakers? What are their companies doing to tell lawmakers not to cut Medicaid? What are their national organizations doing to tell lawmakers not to cut Medicaid? There's power in these kinds of numbers, and the diversity of constituents who will be speaking to lawmakers, from the people receiving the services to the people providing the services, the workforce providing the services. The impacts will be pretty significant, and that understanding needs to be clearly made. And it's okay to ask your providers, are they making calls to lawmakers? Does their company have a position? And if not, can they develop a position? Do they have a professional organization? There's a lot of national organizations that different provider organizations belong to. And does their national organization have a position on Medicaid cuts, and what are those positions? The more buzz and the more conversation and different groups of people that are talking about this, sharing about this, the greater the impact. You can also consider a story pitch to the media. This is a great way to have a big impact. You can let the media know if you have a connection. Many organizations have connections with the media. Many people with disabilities and families have been involved with the media in the past. You can reach out and say you want to share your story, and you want to share why Medicaid cuts are going to have an impact on you, what that means to your daily life, what that means to your family, and get buzz in the media. The media can be a great tool with sharing information, sharing personal experiences, and sharing the impact of Medicaid cuts. And we have a few points, about a sample letter that you could send to your representatives. Writing a letter. Most Congress people have a place on their website where you can email your legislator. You can ask them for a response, and in that email you can include information about Medicaid, the cuts, how they're going to impact you. So, reach out in many different ways. Reach out through phone calls, reach out through email, use other connections that you have, whether it's providers, national organizations, groups of people who, your friends, your families, other people in your community, how you can collaborate to share a bigger message. There are many opportunities, and it's important. So take action. Federal and state lawmakers need to know how Medicaid helps you and your family, what it could mean for your life if the services and supports you have are reduced or stopped. Please go to our website, the BBPD website, and check out resources. This presentation will be loaded there, as well as a number of different resources. I hope this information is helpful, and that you use your voice to express your concerns, and what Medicaid means for you and your family, and you can make a difference. Thank you.